Hi, I'm Marvin Plackett, and today is Thursday, November 5th. Greetings to all residents, to all staff, and to all guests. Currently at this time, we have 3 active COVID cases, and all 3 relate to the gardens. There are 2 residents that have COVID at the gardens, and they are both from Geneva House. Geneva House is 6th floor at the gardens. And one of the residents that contracted it, they were in the hospital. I mentioned that last week, or on Monday as well. They were in the hospital, and now, in fact, they have been transferred to a different nursing home in the Twin Cities. One new resident has been identified as positive with COVID. It's same house, Geneva House, 6th floor, and they are presently still residing at the gardens in the 6th floor. And of course, they are quarantined, and anybody that enters the room, they must be wearing proper PPE and so forth. So we're doing all the precautions that are required by the health department, etc. And the staff person that has COVID, of course, they are at home recovering. So at this time, in our 10 communities of Episcopal homes, we have just the active cases at the gardens, and that's 6th floor in Geneva House. And of course, ample testing is occurring to make sure, and it's occurring daily, to make sure that if there were any, that we're identifying any potential spread. So we are doing, all the right measures here to control this absolutely as much as we can. Testing continues in other places at Episcopal homes at this time, of course, as is the proper protocols to make sure that we are identifying any issues and then containing and controlling the spread. You are no doubt aware, because you're reading the news, paying attention to the news, listening just like I am. Today, front page, Star Tribune, red alert for Twin Cities ICU beds amid surge in COVID-19 cases. Again, Star Tribune, front page article today. 3,844 new cases identified on November 4th. Okay, so that's yesterday, 3,844 new cases in one day. All right, so this is dramatic. I'm just going to read a few of the excerpts here, a few of the facts that are identified in this article. Only 9 intensive care beds were available in the Twin Cities on Wednesday morning. Metro ICU bed space grew scarce as nurses and other caregivers were unavailable. A record 908 inpatient hospital beds in Minnesota were filled with COVID-19 patients. COVID-19 ICU admissions have doubled since late September. And then a short paragraph here. The state dashboard shows that Minnesota has a capacity of 1,501 immediately available ICU beds and another 408 that could be rated in 72 hours. But one Twin Cities hospital physician said that data overstates availability because open beds are useless without nursing staff to treat patients. So Minnesota is a hot spot right now, and we are surrounded by states that are also hot spots. North Dakota, South Dakota, Iowa, Wisconsin, it's all around us. And so we can do those things that are within our control. We cannot control what happens in the surrounding states or most things that happen in Minnesota, but we can control things that occur here at Episcopal homes in your space, right? So we know what to do. We know to wear our masks at all times, that we're not in our apartments or in our units, to stay at least 6 feet apart, to not gather in large groups, to wash your hands frequently, and if you have any symptoms, isolate and get tested. Those are the things that we can do, and they are not 100% guarantees. However, they go a long way towards protecting yourself and protecting your loved ones. So they really matter. We're doing a good job here at Episcopal Homes, and that's thanks to you helping every day by following these strategies, following these tactics that do work. Not 100%, but they really do work. You add them all together, they're very effective. So that's important. remain vigilant. And remember, with Thanksgiving coming up here just around the corner, it's not advised by any of the health experts that you get together in large groups. It's really not. It's risky. Okay, to bring some joy to us today, we have with us Marion McCarthy, who lives at Seabury. So welcome, Marion, and see you all on Monday. Take care, everybody. Bye-bye.
Hello, my name is Marion McCarthy, and I live at Seabury. And I would like to talk to you about so much negativity being surfaced as we are being dictated now how we should live. Face masks, social distancing, no large crowds, which makes living here not as pleasant as it has been. So now I think it's time that we shift our emphasis to the positive for a change and realize how fortunate we really are by offering our thanks and gratitude to our Heavenly Father. Often as I prepare for bed and lay down on a comfortable mattress, warm fuzzy blankets to cover me, I think about the refugees fleeing for the danger in their lives, or the homeless sleeping on the hard ground, shivering all night through, wondering to myself, why have I won the roll of the dice? Why me? But sure am thankful that it is me. The predicament has helped to bring out the goodness also. For example, the neighborhood network for seniors just delivered baskets for the seniors living here to help us go through the predicament. I want to thank Marvin for taking immediate action to help us keep us safe and sound. And to you viewers, I wish the same. Keep safe and sound. Thank you.